Next up is Charles Wolstenholme, and he's going to discuss AgGlow.
Okay. Hi, I'm Charles Wolstenholme. I'm one of the inventors behind the patent pending technology of AgGlow. So I guess I can start with a question is, do you know someone that has been affected by ALS, Alzheimer's disease, or Huntington's? Unfortunately, I think I can answer that question for you relatively easily, and it's most likely yes. That's due to the fact that Alzheimer's disease alone affects over 10% of the adult population worldwide. And these debilitating diseases are extremely hard to treat, and that's due to the fact that scientists have an incomplete understanding of the pathway, and there's a lack of early detection techniques for these diseases. And these limitations are due to the idea that current technology can't detect early stages of the disease. Specifically, they're unable to detect these misfolded oligomeric protein species. That's where our patent pending technology comes in. Not only can our technology be used as a research tool for drug discovery, but it can also be used as a diagnostic for early detection in patients. So, AgGlow is a series of small molecule fluorophores whose brightness dramatically increases upon protein aggregation. AgGlow has numerous advantages over current technology. One, first, it reveals more mechanistic understanding about the disease progression. AgGlow, unlike current technology, is able to be used in live cells, which makes a diagnosis significantly easier. And then also, AgGlow is suitable for high throughput applications such as flow cytometry, which is commonly used in industry for drug screenings. Our team has the experience and the expertise to advance AgGlow. Dr. Xin Zheng has 20 plus years of experience in the field. Myself, having firsthand experience in biopharma, along with the entire Zheng lab, which specializes in the visualization and detection of protein aggregates. AgGlow already has numerous users in research groups across the globe. These are people that have reached out to us by reading our published work, and we are getting more requests each day. AgGlow has a large market potential, even based off of these very conservative estimates. And finally, moving forward, we envision to continue our research to enrich the toolbox, specifically target diseases, and establish licensing agreements with distributors in order to get our technology into the hands of people that need it most. So thank you very much, and I'm happy to answer any questions.
So what's your main differentiator compared to other companies doing similar things?
So as I showed you before, AgGlow is able to report on the early stage of this aggregation cascade. There's no current technology that's able to do that. Also, most of these diseases now, the thought and the idea is that these early stages of the disease is where the toxicity is caused. There's been plenty of drugs that have targeted the later stages of disease, and none of them have worked successfully due to this fact.
So because you're a small molecule, does that mean you're measuring it in the brain or just anywhere in the circulatory system?
We're currently doing human cells, so we have like cell lines, but we have been looking into doing like tissue biopsies and using that as well.
So I had a question to just understand that better. So in terms of thinking about it as a diagnostic, if you're looking for aggregates in the brain, you'd have to do a biopsy of the brain to be able to do the diagnostic. Is that correct?
Yes, at the moment you would have to do that. You'd also be able to, a lot of these diseases, they start in the brain and can then kind of progress throughout the entire body, so it might not be necessary to specifically do a brain biopsy. But at the moment, yes, if it was to be a diagnostic tool, it would have to be a sample from the brain.
So your initial strategy then with respect to how you're going to market is really going to be focused on research applications, is that correct?
Yes, we would probably be more towards the research applications. There's already numerous kits available that AgGlow, as I described, the properties are better. So we plan on targeting not only those kits are more used for academic research purposes. However, we do think that AgGlow has serious potential to be used for drug screening in biopharma, more large-scale industrial applications as well.
And is your market potential that you have there, is that based upon the kits for research and industrial
That is solely
screening?
based on the kits for research.
Thank
We
you.
don't really have a number for, we have no idea what the number
Right.
could be for if we put into the more biopharma application as well.
Okay.
The list of current AgGlow users is essentially a research list. So these are people who are taking your
Yeah, they
material
read
and
our-
using it in their own research.
Yes, exactly. They just saw our work online, thought that this would be suitable for their application, and then requested a small sample from us.
And are you doing that just on research exchange, knowledge exchange, or is that?
Yeah, so more of, research collaboration, we put on more papers and patents along those lines. We have yet to actually start selling any of this.
Do you have any plans as to when you might do that? And with the thoughts on, would you go to market and productize something in the research world?
So we have one, AgGlow Red is fully ready to go. We could all I would really have to do for that is to write a product manual, and if we were to get it into the hands of the right distributor, we have all of the science and technology to back that up and let it be sold. We are still kind of working and waiting for our provisional patent to be approved, I think, before we kind of move in that direction.
Can you talk to me about your conversations with the FDA?
Since at the moment we're targeting more towards the research application, we haven't really had many discussions with the FDA yet. We don't see too many problems just because this is more of a diagnostic application and would not be used. Like, we're not going to need to do any live human trials or clinical trials along that side.
And in terms of your team, you have everything you need, or doesn't really have anyone who's looking at the business aspect to help you
So
decide?
our team's all scientists at the
Okay.
moment. We're still trying to exactly figure out what we want to, the direction we want to go. Most likely, we're looking more towards licensing this we will still continue to do more of the core R&D, where we could get this into a hands of, say, a large chemical distributor, which can, even though in the lab I can easily do scale up, it would be more effective for them to do something along those lines. So we're leaning more towards the licensing the technology instead of going more towards developing the business ourselves.
Okay.
Would there be greater value in having, being able to claim a diagnostic status so you could intervene and get early treatment? If your main premise is early detection, it seems like, early treatment would also
Yeah,
be
so
important.
that is why I mentioned it.
I mean,
and
have my brain biopsied after I'm dead doesn't do me much
So we're
good.
starting to develop, we're working on mouse models at the moment, getting that set up. So then once we get that, we should be able to then kind of move over into human subject biopsies and see the efficiency of that. As I said, we already tested some of the images, so you are already on human cells. We do know that it works on human cells already. Although they're not actual subject samples, they are human cells, so we don't really have too much worry about the translation there.
Okay, thank you. That was the final question.